Assalamu alaikum and welcome into 15th match of Cardiometabolic Premier League, the Battle of Brains presented by PSIM and PHL, powered by Wilson's Pharmaceutical. We are into the 15th match that is between BBH Emperors and Koita Combatants. It is in fact third match of Group E and it would be deciding who is going to qualify for Super 6 stage from Group E. And if we talk about the governing council member presence, we are blessed with the kind presence of Professor Ishaq Saab. He is professor of cardiology at KIHD Karachi, and he is also patron in chief of Cardiometabolic Premier League. Along with him, we have with us Professor Azizur Rahman Saab. He is professor of medicine and president of PSIM, and he would be serving as an umpire of today's match. Along with him, we have with us coach of Koita Combatants, Professor Mir Usman Shah Saab. Welcome, sir, on joining Cardiometabolic Premier League. And along with him, we have with us for moderation purpose, Dr. Hamza Azhar Ghori Saab. He is assistant professor of cardiology and stroke interventionist at RIC Rawalpindi. For further moderation, over to Dr. Hamza Azhar Ghori Saab. Thank you.
Thank you very much, Usman Saab. It's great to be back. And now I would like to take this opportunity to welcome you all to this first season of Cardio Metabolic Premier League, which is brought to you, of course, by Wilson's Pharmaceutical in collaboration with Pakistan Society of Internal Medicine. These are some crucial matches, as we all know, and every match is a virtual knockout. As we have seen in the past, we have had some very close games and we have enjoyed them thoroughly. Today, the weather has been treacherous. I was also under the weather myself, but as we all know, and we always say that the show must go on. Today, it's going to be an important match between BBH Emperors from Rawalpindi versus QTA Combatants right from Quetta. So we can say it's a match between two heavy provinces of our country. I would like to take this opportunity to move towards our highly esteemed panel of council members. So I'll start with our patron-in-chief, Professor Ishaq Saab. It's great to have him. You know, he puts so much into it. He's the life and soul of all the. Along with him, we definitely have our umpire of the match and all the matches. In fact, the whole season is there and he's been there observing each and everything. He is the quintessential adjudicator of all the games. Welcome, sir. It's Professor Azizur Rahman Saab. It's great to have you on the show. We do have other members and coaches, but I do see the coach of QTA, that is Professor Mir Usman Saab. It's great to have you. I can see you there, and I know you're geared up for your team. And as we have more council members coming in, we will have the introductions throughout the game. So with this, I take the permission from the umpire to move towards the teams and start with the introductions. All right, so do we have both the teams? Can we have Quetta on screen, please? Combatants, I'll request your captain to give us the introduction. Please go ahead.
Assalamu alaikum. My name is Dr. Muhammad Adil and I'm a resident of internal medicine. On my left-hand side is, on my right-hand side is Dr. Fazal, and on my left is Dr. Bijar Saab.
That's wonderful. It's great to have you in the match, and I wish you all the very best for the game today.
Thank you so much.
Yes. So now we move towards BBH Rawalpindi, and it's the Emperors, or I would say the Empresses.
Assalamu alaikum. My name is Dr. 𝐏𝐚𝐤𝐢𝐬𝐭 Ghuzar. I am PGT Internal Medicine from BPH, and this is Dr. Mubin and Dr. Imshak.
Welcome to the show, and we are going to have a wonderful game. Best of luck to you for the match. So as we all know that we'll have the introductions, and after that we are going to go towards the coin toss. But before that, I think just a little word about the conditions today. So what we have is an overcast condition. It's been raining heavily. There are floods everywhere, damp outfield. So it's going to get slow. But I tell you, I still expect a good score, a fighting score. And as we can see, so far, it seems as if It's going to be boys versus girls. Let's see who wins today. Best of luck to both of you. And now turning towards the coin toss. Can we have it on the screen, please? So we have it on the screen, and I'm going to randomly ask one of the teams to either call heads or call tails. So can we have BBH on the screen?
Heads.
BBH Emperors. What do you want, heads or tails?
Heads, heads.
They've called heads. Roll the coin. And it's a tails. All right, never mind. So that means it's 𝐴𝐻𝐻 combatants who have actually won the toss. 𝐴𝐻𝐻, are you there?
Yes, sir. We are here.
Okay. So as per the rules of the game, I'm going to pose you with two questions. The first question is whether you want to throw the questions or you want to take the questions.
Sir, we will take the question first.
All right, so you want to take the questions. And now question number 2. You want to have case scenario A or case scenario B?
Sir, we will have case scenario A.
Okay, so they have decided that they want case scenario A. So the news from the center is 𝐴𝐻𝐻 combatants have actually won the toss. They want to take the questions and they've opted for case scenario A. All right then. Are we ready for the game?
Yes, sir, we are ready.
Respected umpires, Patron-in-Chief, shall we start, sir?
Let's start.
Okay, let's start the game then. Can we have the first scenario on the screen? And I'll request BBH, Emperors, to read the question, please.
Sir, should we read it loudly or not?
Okay, so you've opted to take the questions, right?
Yes, sir, we have opted to take the questions.
Okay, so that means, BBH, are you ready to ask the question? So read the scenario. So BBH is going to read the scenario and then the questions. BBH Emperors, can you hear me?
Yes, yes, sir. Acha. 56
Technical
year old.
team, can the Emperors hear me?
Yes, yes, sir.
Okay, so you have to read the scenario and then you'll read the questions. All right, go ahead, please.
A 56-year-old male with a 15 years history of poorly controlled type 2 diabetes, hypertension, and dyslipidemia is found unresponsive at home. He was last seen well 2 hours ago. Emergency service find him in ventricular fibrillation on ECG and initiate CPR. Return of spontaneous circulation is achieved after 5 minutes. He is now intubated and in the ICU. Family reports he had no chest pain and had mild dyspnea and fatigue over the past week. He was non-compliant with medication and has missed follow-up for the past year. Lab shows HbA1c 9.8%, LDL 145 mg per dl, TROP-I mildly elevated, ECG non-specific STT changes. Echo shows LV ejection fraction 35%, no regional wall motion abnormality. Chronic angiography, diffuse small vessel disease, no obstructive lesions.
All right, so I'm going to give 𝐴𝐻𝐻 combatants a couple of seconds to gather themselves. And once they are ready, we'll move to the questions. Combatants, are you ready?
Yes, sir, we are ready.
Okay, have the first question on the screen, please. BBH, read it, please.
The most likely cause of sudden cardiac arrest in this diabetic patient is option A is acute myocardial infarction. Option B is electrical instability from diabetic cardiomyopathy. Option C is acute pericarditis. Option D is pulmonary embolism. And option E is hypertrophic cardiomyopathy.
And your timer, 60 seconds, are on your screen. This seems like an outswinger. Let's see how they negotiate.
Sir, we have the answer. It's A.
Are you sure you want me to lock A alpha?
Yes, sir, we are sure. It's A.
So they've come out of the crease. They want to play it through the covers. All right, lock A alpha. Oh, and that one took the edge and goes into the first slip. My goodness, you've lost the first one. I knew Ishaq Saab was never going to be happy. They always want you to take your time, make the most of those 60 seconds that are there at your disposal.
I'll repeat my advice. Please take your 60 seconds and don't jump on the conclusion so quickly. Discuss among yourself and consume the time, and maybe you come with the correct answer, you see. So, sorry, not a good beginning.
Thank you very much, sir. I think some very important points, and you must pay heed to this. And I will also request the answering team to keep their mics open, unmuted, so that we can hear the discussion. That discussion becomes very important. So, can we have the next question? Question number 2 on the screen.
Question number 2 is, which pathophysiological mechanism is primarily linked to sudden cardiac death in diabetes? Option A is enhanced parasympathetic tone. Option B is hyperinsulinemia-induced vasodilation. Option C is QT interval prolongation. Option D is atrial fibrillation. Or option E, AV node block.
60 seconds are on your screen.
इंसुलिनोमिक इंड्यूस्ड वॉइस वो तो इंड्यूस्ड वॉइस वैल्यूएशन तो नहीं है क्यूटी इंटरवल प्रोलॉन्गेशन तो नहीं होगी ए फिब भी नहीं है एवी नोडल ब्लॉक भी नहीं है प्लस में आता है वो या तो प्लस में तो
25 seconds. Another outswinger I can see. Discussion going on.
Sir, A.
Are you sure? You want me to lock it?
Yes, sir, lock it.
A alpha, right? You want me to lock A alpha?
Yes.
Okay, they want me to lock A alpha, and that's the wrong answer again. Another outswinger. My God, 2 misses in a row. Come on, Quetta combatants, you have to combat it hard. And we are hoping for the third one to go for a 6 now. Come on. Okay, can we have question number 3 on the screen, please?
Question number 3 is, what ECG change is most associated with increased SCD risk in diabetic patients? Short PR interval, prolonged QTs. Option C is delta wave. Option D is Morbid's type 1 AV block. Or option E, sinus bradycardia.
Timer starts now. So I'll request the answering team to keep their mics patent. Everybody else, I'll request them to keep the mics muted, please.
So prolonged keeping के अलावा नहीं शॉर्ट पीआर इंटरवल नहीं हो सकता डेल्टा वेव नहीं तो उसमें डेप्थ नहीं होती सर
Approaching 25 seconds.
Sir, B.
Okay, you want me to lock option B? Are you sure?
Yes, sir.
B beta.
Yes, sir.
Okay, so that's a short one. They want me to lock B beta. Lock it. Yes, and that's very well played. And we're on the board now. A logical answer, a logical pull for a 6. Well done. So you're on the board. You can still put up a good total. And we are keeping our fingers crossed because we want to see a good fight today, like always. Well done. Well played. Moving to question number 4 on your screen.
Which one of the following is an independent predictor of sudden cardiac death in diabetes? A. Frequent nocturia. B. Microalbuminuria. C. Hypernatremia. D. Retinopathy. E. Diabetic foot ulcer.
Timer is on your screen. 60 seconds.
Is an independent predictor. Hypernatremia. Yes, sir. ये retinopathy है. Yes. Already आपने उतना develop किया होगा. B है. B कौन सा nuclear?
25 seconds to go.
सही है, ठीक.
15 seconds. Come on.
Sir, B.
Okay, B beta. You want me to log B? Are you sure? Are you sure? Should I lock it?
Yes, sir.
Okay, they seem to be sure. Let's lock B. And yes, very well done, very well played. It was a slower one. They picked it well, and it's a wonderful answer. Quetta, well done, very well played. A 6 that we were all looking forward to. Good job. So now moving to question number 5 on your screen. Read the question, please. BBH.
The echocardiographic finding of reduced ejection fraction of 35% suggests which underlying diabetic complication? A. Restrictive cardiomyopathy. B. Diabetic autonomic neuropathy. C. Diabetic cardiomyopathy. D. Mitral stenosis.
A bit loud, please.
E. Infective endocarditis.
Okay, so 60 seconds. The timer starts now. And I will request BBH team to speak closer to the mic and be a bit loud. Thank you.
Sir, B.
Are you sure about it? Option B.
Yes, sir, lock it.
You seem to be liking B a lot. Beta, you want me to log B beta, right?
Yes, sir, it seems the most probable answer to us.
And he seems to be pretty confident. All right, block B beta. Oh, not so probable after all. Okay, so we have another wrong answer here, and we were looking forward to having a hat trick of 6s. Never mind, never mind. You still have 5 more questions to go, and you can score reasonably good. Play smartly, take your time, be sensible. All right, question number 6. On the screen, please.
Structural changes in the myocardium is associated with diabetic cardiomyopathy. A. Fibrinoid necrosis. B. Amyloid deposition. C. Granuloma formation. D. Interstitial fibrosis. E. Fatty infiltration.
Okay, 60 seconds on your screen.
देखो मुझे नहीं लगता फैटी इन्फेक्शन होगी. इंटरस्टिशियल फाइब्रोसिस भी नहीं लग सकता. ग्रैनुलोमा नहीं बनता डायबिटीज में. अमाइलॉइड हो सकता है. ये फिब्रिनॉइड नहीं होता. वो बहुत ज्यादा उसके डायबिटीज क्रॉनिक डिजीज में क्या हो गया. अमाइलॉइड फिब्रिनॉइड प्रोसेस तो उसके बाद होता है.
25 seconds to go.
मुझे भी लग रहा है. Say, sir, A answer. Lock A, sir.
Lock A. So this time he wants me to lock it. You know, he's confident, I think. All right. A alpha, right? You want me to lock it?
Yes, sir.
Lock A alpha, please. Oh no! My goodness. The discussion was going on, and yet we got the wrong one. Oh my God. Okay, so again, we are on the wrong trot. 2 misses. Okay, so I would also like to mention here that on the screen, we also have the captain of BBH. I think he's back. He was unable to join us because he got stuck on his way. And at the same time, one of the members from Quetta Combatants, I think he's also missing. He had some emergency. So we've got 3 contestants over there, whereas we have 4 contestants now from BBH. So the umpire is there. Sir, should we let him join?
Yes.
Okay,
Come on, sir.
so great. So I think we have him on screen. That's great to have the full team there. All right, I think the team is doing pretty good at the moment. Quetta needs to get on track. They need a good score. They need a couple of 6s now coming their way. So with this, we move to the next question. That's question number 7 on the screen.
Question 7. Which is the best long-term management strategy to reduce risk of recurrent SCD in this patient? Option A is lifelong anticoagulation, B, beta blockers only, C, nitrates, D, implantable cardioverter defibrillator, and E, heart transplant.
And your timer is on the screen.
Don't think so.
Quetta needs to play it smartly. Come on.
Beta blocker the life survival. Life long term management strategy. Beta blocker is beta blocker. Mortality benefits. So actually last to
25 seconds.
Sir, beta blockers, log B.
Okay, again, they have a propensity towards locking B. They really like B, I guess. And they want me to lock B beta. Okay, I'm going to lock B beta. Oh my goodness! I could only hear beta blockers throughout, and that's another miss. So the off spinner came in, bowled a straighter one, and it was missed. All right, never mind. Just 3 more questions to go, Quetta. Come on, you can do it. We want a good match. I know the pitch is a bit difficult at the moment for you, but you can do it. Can we have the next question on the screen?
Question 8. Which medication class has proven mortality benefit in reducing sudden cardiac death in patients with diabetes and low ejection fraction? Option A is nitrates, B, calcium channel blockers, C, SGLT2 inhibitors, D, alpha blockers, E, insulin.
60 seconds on your screen.
Sir,
As
C.
a cardiologist. Okay. Have you answered?
Yes, sir. C, sir. Lock it.
My God, they've come down the wicket and they're going for a big 6 this time. Ishaq Saab has his heart in his mouth. I know. You want me to lock it?
Yes, sir. Lock it, sir.
Which option?
Sir, C.
C Charlie. Okay. Lock C Charlie then. Yes, that's a 6. A much needed 6. Came down the wicket this time, got it on a full toss, and here it goes for a 6. Very well done. So I was about to say, I don't know about all of you, but as a cardiologist, I'm really enjoying this scenario. So, well done, well played. And you can still post a fighting total. And that's all we want. We want a good fight. Okay, second last question of this innings. Question number 9 on your screen.
Question 9. Which of the following diabetes-related complications increases the risk of silent ischemia and sudden cardiac death? Option A, cardiac autonomic neuropathy, B, diabetic gastroparesis, C, diabetic retinopathy, D, diabetic nephropathy, and E, insulin allergy.
Timer is on your screen.
और तो कुछ नहीं आप तो कुछ तो ऐड नहीं करते एक बार सोच लो
It's a flighted delivery again.
Sir,
You're winding
lock
up to
on,
wait for a 6.
sir,
Yes,
lock answer
please.
D, sir. Sir, D.
D delta. Are you sure about it? You want me to lock it?
Yes, sir, lock it.
That's a much needed 6 that you need this time around. So they want me to lock D delta. Lock it. Oh, goodness. All right. So that's a miss. Again, a flighted delivery. Turns out it was a googly, went the other way. I think you went too far away from the delivery, to be honest. All right. So, last question of this first innings. Can we have it on the screen?
Question 10. Which test would be most helpful to assess autonomic dysfunction in a diabetic patient at risk of sudden cardiac death? Option A, fundoscopy. B, 24-hour Holter ECG. C, deep breathing heart rate variability test. D, HbA1c. E, treadmill test.
Timer starts now. 60 seconds on your screen. Come on, we want a big 6 now. Play it
Sir,
smartly.
Sir, C, sir.
Are you sure? You've come down the wicket and you're going for a big 6, right?
Yes, sir.
Over long on. So you want me to lock it?
Yes, sir,
Which
lock it.
option?
Sir, C.
Okay, they want us to lock option C, Charlie. Lock it. And yes, it's a 6 for sure. Very well played. Over long on. You played along the line. And well done. So a much needed 6 just on the last delivery. And that puts a total of 24 with 4 correct answers. I think it's a lowish total, but still, you should never lose hope. Anything can happen anytime. So with this, we've now come to the mid part where the first innings has been done. And I'll move towards our panel of experts. We have Professor Ishaq Saab. Sir, your comments on the game so far.
Thank you, Hamza. A bit disappointed by their performance. Actually, the question and the answer of number 1 question, if they had concentrated on that correct answer, the rest of the questions were related to that. All the rest 9 questions were legacy of the same question answer. And they should have remained in that domain. You see, the scenario, excellent. And then the first correct answer was a lead to know what's going on. And the rest of the 9 answers would have been easily answered if they had just kept that first question and the answer in mind. Because that was a continuation of the same thing. So anyhow, they have tried. And I won't say it was a difficult one. 1 or 2 questions may be difficult, but I think they're all interconnected. And they should not have missed these. So it's a compared to what we had last week, Professor Aziz Rahman sir will bear with me, that we had a team scoring 10 out of 10 and the other one 9 out of 10. So we had such a wonderful match. And so from that point of view, a bit disappointment. But anyhow, these are learning curves and learning times, and they should not lose hope. They should work hard and I think the scenario जो होता है उसका मतलब होता है कि वो एक एरिया में आपको ले जा रहे हैं, एक डिजीज एंटिटी की तरफ आपको लेके जा रहे हैं, और वो जो क्वेश्चन सारे आंसर आ रहे हैं वो उससे रिलेटेड हैं. तो अगर आपने एक सही क्वेश्चन का कर लिया तो बाकी जो हैं वो इंडिपेंडेंट नहीं हैं, दे आर कनेक्टेड. So I think they should, the other team should keep this in mind. But anyhow, thank you very much. Professor Aziz, I will have his input.
Thank you very much, sir. I think very important and key points. There was a sequence in this whole scenario and the way the questions were asked. But I still think lowish, no doubt. But the idea is to fight till the end. And we now turn towards Professor Azizur Rahman Saab. He's the umpire. Sir, your thoughts, please. Aziz Saab.
Unmute करें उन्हें.
Aziz Saab, you are
उनको
still
unmute
muted.
करें, please. He is muted.
Aziz Saab, you're muted. Aziz
Unmute
Saab, we
करें
can't
उन्हें.
hear you. You are muted. Unmute कीजिएगा जी. You have to unmute. Technical,
Actually,
yeah.
can you hear me now?
Yes, we can. We can.
Actually, at the moment, I'm connected with two devices because there was an internet problem. Okay.
Right, sir. We can hear you. Yes.
Yeah. I think definitely the performance of 𝐏𝐚𝐤𝐬𝐭 competitor was a little disappointing, but I think the scenario was slightly difficult, though it was very interesting and relevant. But I think this is something we don't often talk about on the bedsides. Perhaps that is the reason. And but they missed some very, very obvious questions, like in one, the predictor of certain cardiac death. There was a choice between cardiac autonomic neuropathy and nephropathy and other stuff. I think it would be very intuitive to choose a cardiac autonomic neuropathy. They missed that also. So of course they need some more training in this area. And as a question setter and as an umpire, it is never possible, or at least easy, to set the same difficulty level. Maybe this was a little difficult scenario, but this is their luck. Then we have to go by the system, and unfortunately they could not perform very well. I would like to have their opinion, and the contesting team, what is their opinion about the difficulty index of this scenario? Was it unreasonably difficult or what?
Yes, 𝐏𝐚𝐤𝐬𝐿 combatants. Can we have your thoughts, please? There's a question for you by Professor Saab.
Sir, yes, sir. Sir, we found it, sir, extremely difficult, to be honest. I mean, I have given myself MRCP2 examination recently last year. These MCQs, these questions were tougher than that, if I were to say. And probably I am not a cardiologist, neither I am the resident of cardiology. So few of the questions were totally a new domain for us. We haven't studied about that.
Right. Thank you very much for your thoughts.
Professor Aziz has, I think, noted that, and I also would join him in noting this. But let me tell you, at least 3 questions were such that should not have been missed, like the prolonged QT interval and sudden cardiac death. Is a very obvious connection. Like ICD,
yes, sir.
You don't give beta blocker, doesn't give you any protection against sudden cardiac death. It's the ICD which is implanted. And there was 1 or 2 other questions which were quite obvious. Autonomic neuropathy, diabetic autonomic neuropathy. So I think maybe it was slightly difficult as a whole, but at least 3 questions were such that every internist could have answered correctly. Aziz Rahman Sahab, do you agree with me?
Yes, that's right, sir. I agree with you.
Thank you.
Right. So thank you very much for your comments. I think we do understand the level of difficulty, but I think we come across these questions in our everyday scenario, even as medical specialists.
On a lighter note, Hamza, जो क्वेश्चन हमें आसानी से हम कर सकते हैं, वो इनको आने चाहिए.
Bilkul, sir. I think you're nailing it with all the comments. So these are some common findings that you will come across in your wards and your patients, for sure. And the idea is to learn, to know.
But their comments are noted, I think.
Yes.
But they, again, जैसे अजीज साहब ने कहा, luck है, इनको ये सिनेरियो नहीं लेना चाहिए, दूसरा ले लेते. अब देखें वो लोग क्या करते हैं.
हाँ सर, उसमें देखें, very rightly said, and that's why we have this concept in this whole competition, because you see, you are posed with 2 questions, just like a toss. It's based on chance, and you have this.
मैं कार्डियोलॉजिस्ट, ये कहना कि मैं कार्डियोलॉजिस्ट नहीं हूँ, इंटरनिस्ट हूँ. This is all merged together, you see. Cardiology is internal medicine. It's nothing else. We are not asking to perform any procedure to us, but cardiology, medicine, 70% is cardiology or 60% cardiac and diabetes. So I think ये तो कोई बात नहीं है कि, लेकिन ये कि चले हम आपका बात मान लेते हैं कि 1-2 क्वेश्चन मुश्किल होंगे, but overall आपकी performance was not up to the mark. So
So
please keep
one
it
thing
up.
is for sure today. One thing is for sure today. Today, all of them will be walking out as medical specialists who are definitely ready for some cardiac issues. So the idea is to learn, and that's why we are holding these competitions. So I think still we are halfway through, and the next innings is still there, and we keep playing till the last ball, as we know. Now, we did have the mentor and coach of Quetta with us. Do we still have Professor Khalid Shah and Dr. Mir Usman, if they're there, their comments? So I think.
No, they are not with us, sir.
Okay. So with this now, we are going to move towards the second half of this competition. So can we have it on the screen, please? The next scenario. Okay, we have it on the screen, and I'm going to request Quetta combatants to be ready, geared up, and upbeat about this. You can still do it. So I'll request you to read this scenario, please.
A 34-year-old female with 8 weeks of gestation visited OPD for regular antenatal checkup. She is concerned about diabetes as her mother is diabetic. Her fasting blood sugars are within normal range.
Okay, so just a few seconds for BBH. Are you ready?
Yes.
Can we have the first question on the screen, please? Read it.
Which investigation
Good.
protocol would be followed for her? A. HbA1c, oral glucose tolerance test at next visit, oral glucose tolerance test at 20 weeks, oral glucose tolerance test at 24 weeks. No further testing required.
The timer, 60 seconds, start now. That's a good length delivery. I see BBH discussing, and the captain is also trying his best to be a part of this discussion.
Option D.
Okay, are you sure about it?
Yes, sir.
Should I lock it? D delta, right?
Yes, sir.
Okay, they want me to lock D delta. Lock it. And yes, that's a wonderful start. Good start with a 6. A good length delivery, and they've put it over the long horn boundary for a good 6. So that's a good start. Well done. All right. Question number 2 on your screen now.
What dose of glucose is given in oral glucose tolerance test? A 100 grams, B 75 grams, C 50 grams, D 150 gram, and E 120 gram.
And the timer starts now.
Option B, 75.
Okay, they've come down the wicket. They're trying to have a Jayasuriya act at the moment. Are you sure you want me to lock it?
Yes, sir.
B beta, the captain says do it. He's confident. Right. Okay, you've come down the wicket. I'm going to lock B beta. Lock it, please. And yes, made a full toss out of it. And this one is going over the bowler's head for a 6. Well done. Well played. So 2 6s in a row. That's a good start. Okay, the pitch has changed, I believe. Okay. Can we have the next question, question number 3 on your screen?
Her OGTT results are as follows. Fasting levels are 90 mg per dl. 1 hour levels are 186 mg per dl. 2 hour levels are 155 mg per dl. How would you interpret the results? Normal OGTT results, gestational diabetes mellitus not confirmed, impaired 2 hour levels, impaired fasting levels, gestational diabetes mellitus confirmed.
And your timer starts now, 60 seconds.
सर कंफर्म इम्पेयर्ड नहीं है
25 seconds to go.
Option E, GDM confirmed.
Okay, so you want me to lock E epsilon, right? Option E, epsilon. Should I lock it?
Yes, sir.
Okay, lock E epsilon. GDM confirmed. And it's a confirmed 6. Very nicely played. Third 6 in a row. Great play, great stroke making. And I think that was well thought out. Very well done. For a moment, I thought maybe this one is going into the stumps. But then you've done well. Very well played. All right. Question number 4 on your screen.
She is advised ultrasound to assess the fetal well-being. What parameters would be specifically looked for in view of her OGTT? Fetal heart rate, polyhydramnios, small for gestational age baby, placenta position, or anomalies of beta heart development. Anomalies
Okay,
of
so
heart development.
option E is anomalies of fetal development, and 60 seconds on your screen, please. Is this going to be a fourth one where the scores will be leveled? Let's see.
पोली भी होता है ना इसके अंदर, हैं? क्योंकि उसमें उन्होंने स्पेसिफाई नहीं किया कौन सी नॉर्मल्स हैं। Option E.
Option E, epsilon. Anomalies of fetal development. You want me to lock E, right?
Yes.
Okay. Lock option E. Oh, that's the first blemish, the first miss. You were talking about the right option. I could hear the right option somewhere. You could have leveled the scores, but never mind. All right, so you still, at times it can still get tricky. Good. So we still have something in the pitch. Let's see what happens in the next question. Question number 5 is now on your screen. Read it, please.
Her ultrasound shows severe polyhydramnios. She is 26 weeks of gestation and taking oral hypoglycemic drugs. Blood sugars are well controlled now. What other medication could be beneficial for her to improve polyhydramnios? A loop diuretic, aldosterone receptor antagonist, indomethacin, AC inhibitors, dexamethasone.
Timer is on your screen now.
D26 पे डेक्सा क्यों देंगे? वो तो देखते हैं ना कि वो लंग्स को मैच्योर करने के, वो तो लास्ट ट्राइमेस्टर में देंगे ना। एसीए तो वैसे कॉन्ट्राइंडिकेटेड होते हैं, एंडोमेथाजोन देते हैं, एल्डोस्टेरोन
25 seconds left.
I'm not sure. एंडोमेथाजोन क्यों नहीं देते?
15 seconds. Come on, 10 seconds. Hurry up. Answer, 7 seconds.
Option A.
5. Option A. Are you sure? A alpha.
Yes, sir.
Okay, just at the last moment. They're not sure about it. They want me to lock A alpha. Lock it, please. Oh, and we knew it. They were not sure. And that one just missed it. It was a leg cutter. And the captain has got a big smile on his face as well. He knows. And it's becoming quite competitive. You see, Quetta, come on, keep your hopes high. You can still do it. Anything can happen in this game. All right. So, best of luck to both the teams. And with this, we move to question number 6.
She started on indomethacin on alternate days. For how long she can continue this medication? Till 32 weeks, till 38 weeks, till delivery, 1 week postpartum, throughout the entire pregnancy.
Start the timer.
देते हैं हम जब पीडीए हो
25 seconds.
सर क्या करना
Approaching 15 seconds now. Come on.
पॉलीहाइड्रो के लिए दे रहे हैं तो पोस्टमार्टम के देंगे 1 वीक आफ्टर पोस्ट
10 seconds.
नहीं है जल्दी बताएं क्या सर
Hurry up. 7, 6. Come
E
on.
ऑप्शन ई
Okay, so just in the last moment, they didn't know where the ball was going. They've given it a swing. They were looking at the captain. Captain was also, I think, clueless. Let's see. They've asked us to lock E epsilon. Lock option E. Oh, truly, that's a miss. And this one going right into the stumps. You missed it completely. All right. 𝐏𝐚𝐤𝐢𝐬 is now at the edge of their seats. They see some glimmer of hope there. And as I told you, it's a funny game. All right, with this, we now move to question number 7. 4 questions to go. You have to get 2 right to win it. Question number 7.
Patient missed subsequent follow-ups as her abdominal distension improved. Now she is 34 weeks pregnant and she is taking indomethacin. Apart from stopping the drug, what investigations would you would suggest the patient for possible adverse effect? Amniotic fluid examination, fetal renal studies, fetal echo, BPD diameter, or AFI measurement?
Timer starts now. 60 seconds on your screen. So the pitch has started spinning. There's a change in the pitch now.
वैसे इंप्रूव हो गया ना बीपीडी डायमीटर और इंडोमेथासिन कराता है इसका यूजीआर
I think the fetal renal
amniotic fluid के देख करवा रहे हैं एग्जामिनेशन
25 seconds. 15 seconds.
ऑप्शन सी
Are you sure about it? C, Charlie?
Yes,
Fetal
sir.
echo.
जी
Okay, they seem to be quite sure. Let's see. Lock C, Charlie. And they got this one right. Yes. Very well played. It turned the other way, but I think they've played it over the extra cover for a 6. So now we have scores leveled at 24. And we still have a few questions to go. So let's see what happens. Can we have the next question? Question number 8 on the screen, please.
What is major side effect of this drug for the fetus? Tetralogy of Fallot, premature closure of the ductus arteriosus, VSD, ASD, or truncal atresia?
Timer starts now.
ऑप्शन बी
Oh, they've come down the wicket. You want me to lock it?
प्रीमेच्योर क्लोजर हो जाता
They're not sure.
है नहीं
Okay, take your time. You still have 40 seconds.
हम कह रहे हैं कि पीडी क्लोज है इनका बोला प्रीमेच्योर क्लोजर ऑफ डक्टर आर्टरियोसिस क्लोज करता है बी सही है
25 seconds.
एएसटी तो नहीं है
15 seconds.
ऑप्शन बी है बी तुम क्या कह रही हो ऑप्शन बी
You're sure this time I should lock B beta, right?
यस सर
Okay, now, they want me to lock B beta. Let's see what happens. Is this the winning stroke? Lock it. B beta. It is the winning stroke. Well done. You knew it. Your first instinct was right there, but then again, you wanted to be sure. And I think that's the right way to go about it. You always take everyone into account, discuss things, and then you come up with the answer. And very well done. I'm sure Ishaq Saab is also happy to see the way you approached this question and everyone was chipping in. So very well done. We know the outcome of this game, but I think we still have 2 more questions to go, and it's all about learning. So, question number 9.
Hamza, what they are doing is
Sir.
they are connecting with the previous answer.
Yes. Very rightly
So,
said.
as I said earlier, it is a continuation, you see, which matters. So, I think it's a common sense approach that जो पिछला जो हमने क्वेश्चन किया है और इसमें क्या what is common?
Related to heart, something like eco.
Can you answer, please? It's a logical question. Anybody, even Quetta can answer that.
We did eco, definitely to know something about
See
heart.
the
Lekin obviously that other things are also related to endomycin.
So let's proceed now.
Okay. So you see, the idea was to make it clear to you, both the teams, that these questions, they have a logical pattern going on. And you're collecting, you're connecting the dots, you're collecting information, and then you have to put the pieces together. So whenever you look at any veneer, any question, any scenario, always make the most of it by utilizing all the information. Anyhow, with this, we move to the next question, which is question number 9. Can we have it on the screen, please?
She was given injection dexamethasone as per new guidelines for fetal maturity. Her blood pressure on the next day was 160 by 100 mmHg. What antihypertensives are recommended at this stage? AC inhibitors, ARBs, beta blocker, diuretics, methyl dopa.
Okay, 60 seconds are on your screen. Now they can swing it in all the directions since they know the outcome. Let's see. But always remember, the scores are going to matter even for the winning team. The higher you score, the better chances you'll have in your subsequent progression in this league. Approaching 25 seconds.
ड्रग ऑफ चॉइस तो बीटा ब्लॉकर है, लेबुटालोल है, तो हम मिथाइल डोपा देंगे.
15 seconds.
लेबुटालोल देते हैं. हाइपरटेन.
10 seconds. Come on. Answer.
Option E. Methyl dopa.
E epsilon. Okay, so they want me to lock option E epsilon. Lock it. And yes, very well done. Again, your instincts, they were there. The first answer which comes to the mind, it's mostly, most of the times that's the correct one. So you played it well. Very well done. Very well done. And the higher you score, the better chances you'll have of progression. Good, very well done. And with this, we move to the last question of today and today's match. And it's question number 10 of the second innings on your screen.
What is the mode of action of methyl dopa? Agonist, alpha 2 agonist, alpha 2 antagonist, alpha 1 antagonist, and alpha or beta blocker.
The timer starts now, 60 seconds.
एंटा होगा ना, एंटी हाइपरटेंसिव है. अल्फा 1 है या वेज़ोडाइलेशन कराता है. ए या A2 है. अल्फा 1 है.
25 seconds. 15 seconds.
B. तुम क्या कह रही हो? A कर दूं?
9, 8, come on, you can answer this. Come on.
Sir, option A.
Option A, they want me to lock A alpha. Okay, lock it. Oh my goodness. You got this one wrong. Oh. Well, never mind, because we still know the outcome of the game. And overall, I think you've done well. You've put up a score of 36, and BBH have done it. The Emperors, BBH Emperors, have won the game today. But I think Quetta combatants, they also came in the game a bit late, but then they tried. I wish they could have scored a bit more. And we do have all the reasons. We can always find out reasons as to why we had not done well, but I think it's the spirit of the game which is important. And today everyone is taking home a lot of knowledge, a lot of key points, and this is going to help you in your future endeavors. It's the learning, which is the learning aspect, which is most important in all such competitions, and this is what we are here for. So we are all winners at the end of the day. And with this, I think I'm going to take the faculty on board. I have our patron-in-chief, Ishaq Saab. Your thoughts, please.
Thank you very much. I think the team has done very well. That's why they have won the match. Not with the outstanding score, but a better score than the Quetta combatants. Actually, obstetric medicine is a specialty that we often forget, you see. Treatment of hypertension and other arrhythmias and all this during pregnancy is our domain as an international cardiologist. And obstetric medicine is a very important section that is often neglected. So I think this question has highlighted the importance of obstetric medicine and how to treat it, you see. I think they have played well, the girls, and the girls should be more into obstetric medicine, and they should know better. I think both the teams need to be encouraged and complimented. At least they have taken part and they have faced the questions. They have answered some wrong, some right. But that's a game, you see, we are playing, and we hopefully we will have some better conclusion out of all this exercise. So my congratulations to the winning team and my encouragement to the losing team, and they should concentrate. And as we already told them that the subsequent questions are in continuation of the same scenario. Questions belong to the same scenario. So they are connected. So जैसे आपने कहा कि वो dots को fill करना है. So I think we should do that. And that's all that I have to say. And thank you very much for your excellent moderation. And Professor Azizur Rahman will have. But I think, as we have already noted, the first scenario was slightly difficult for an average internist. But this is cardiometabolic, so diabetics and cardiology both. So one question was from cardiology, the other question was from the diabetes. It was their luck, jo bhi kisko mil gaya. Thank you very much.
Thank you very much, sir. I think your words are always pearls of wisdom for all these young guns. They are the future. And yes, this scenario related to obstetrics and gynae, it's always important for us as cardiologists, even as medical specialists. We all know how many times we have to go and take those consults and see these patients and optimize them before they move ahead. So extremely important, and we need to know these things. And even in a cricket match, the pitch at times, and that's why you have the element of toss, and you at times start with an advantage, and there are times when you start with a disadvantage. And that's why in this format we have 2 questions, 2 scenarios, and nobody knows who's going to get what. So it's your luck. Whatever you get, it's based on, you always have a 50-50 chance of getting whatever is there. So, but I think at the end of the day, it's the learning aspect that's important. We all are winners. You all are winners, and you've done it so wonderfully well. And I do have Professor Azizur Rahman Saab. Sir, are you there for the final thoughts?
Yes,
He's
yes,
the umpire.
yes, I am.
Sir, please, your thoughts, please.
Well, this was very, very interesting match, and no doubt it was a little difficult one. I think the best part of the match was, can you hear me?
Yeah, we can hear you, sir.
Yeah. I think the best part of the match was the commentary, undoubtedly. I think we enjoyed that very much. And the second part of the match, I think very interesting. There were many, many learning points in both the scenarios. So I hope everyone, including the faculty and the umpire and the commentator and everybody, must have learned some new points. So I think that is the entire purpose of this exercise. So I would encourage both the team and don't feel bad. I think the winner is definitely feeling good. But even the losing team, they also did well because the scenario was slightly difficult. So I think let's hope for the subsequent matches to be even better.
Thank you very much, sir. I think, again, wonderful pearls coming from Professor Aziz Saab. You know, he is such a keen eye. He's always there and trying to neutralize things for all of you. And both the teams did very well. I don't think we have any of the mentors or coaches, because I did see the Quetta mentor and coach a couple of times. And if we have Professor Mir Usman Saab or Khalid Shah Saab, we could have their words and their thoughts, but I don't see them anymore. But still, I think, Quetta, you should go back with your head held high. It was a difficult scenario for you. And again, in cricketing terms, the pitch was difficult when you were batting, but you did very well. And for me, we have two winners of obviously on paper, BBH Emperors have won, but Quetta combatants, they combated hard and they are now battle hardened for whatever challenge that is going to come their way. And with this, we now come to the end of this game today. I would take the opportunity to thank you all for your time, your presence. And with this, I'll be now signing out from here. So till next time, Allah Hafiz from my end.